All right. Hey, everyone. Welcome back. We're going to be taking a deep dive today into something pretty heavy, but really important. We're going to be talking about mental health in America.
Yeah, it's a tough topic, but a crucial one, I think.
Yeah, absolutely. And, it's something that we hear about all the time, right? It seems like every day in the news, there's another story about, rising rates of depression and anxiety, even suicide, unfortunately. And it can feel, honestly, kind of overwhelming.
It is overwhelming. And, we see the statistics, and they are pretty startling.
Yeah, for sure.
I mean, just to put it in perspective, we're talking about 1 in 5 adults in the U.S. experiencing some form of mental illness every year.
Wow.
That's 20% of the population. And, it's not just adults. It's impacting young people at really alarming rates, too.
Yeah, I was going to say, it seems like especially teenagers and young adults are really struggling these days.
Yeah, absolutely. Recent data shows that like a third of high school students report feeling persistent sadness or hopelessness.
Wow.
And that's a 40% jump from just a decade ago.
That's a really scary statistic.
Yeah, it is. And, and then when you look at suicide rates, it's really heartbreaking. In 2022, over 13 million Americans seriously considered suicide.
Wow.
And it's a leading cause of death, especially among men and older adults.
Yeah, I was going to say, and it's interesting you bring up the gender difference there because it does seem like men are disproportionately impacted when it comes to suicide.
They are. Men are nearly 4 times more likely to die by suicide than women.
That's a huge difference.
Yeah. And, there are a lot of theories about why that is, but, some experts believe it might have to do with societal pressures. This kind of traditional masculine ideal where men are discouraged from expressing emotions.
Yeah, that kind of toughen up mentality.
Exactly. And, that can lead to people bottling things up and not seeking help when they need it.
Yeah, absolutely. And, we were talking about different demographics, but it's also really important to remember that the mental health crisis doesn't impact everyone equally.
Oh, absolutely. Yeah.
Certain communities like Black and Indigenous populations face even greater challenges.
Yeah, you're absolutely right. They experience higher rates of mental health issues and also face significant barriers to accessing quality care.
Yeah, I was going to say, it's not just about having access to care, it's also about having access to culturally competent care.
Yes, exactly. And that includes things like having providers who understand their cultural background, who speak their language, who can really address their specific needs.
Right. And there's, systemic healthcare disparities at play as well.
Oh, absolutely.
Which, are even more pronounced when it comes to mental health. So, yeah, it's a really complex issue with a lot of layers to it.
It really is.
And then, of course, on top of all of that, we had the COVID-19 pandemic.
Oh, yeah.
Which really just threw everything into chaos.
It did. It really exacerbated a lot of the challenges that already existed, and it created new ones, too.
Yeah. I mean, think about the isolation that so many people experienced.
Right. And the fear and the uncertainty, the economic stress.
It's no wonder that we saw such a significant decline in mental health during that time.
Yeah. And, the pandemic also put a huge strain on our healthcare system as a whole.
Right, which was, already struggling to meet the demand for mental health services.
Absolutely. So, yeah, it was a really difficult time for a lot of people.
It was. But, one positive thing that I think has come out of all of this is that we're finally starting to see a shift in how we talk about mental health.
Yeah, that's true.
It's becoming less stigmatized.
Absolutely.
People are more willing to open up about their struggles.
Yeah. And I think that's partly due to, high-profile figures like, Dwayne "The Rock" Johnson.
Yeah. He's been very open about his struggles with depression.
Yes, and Selena Gomez, too.
Right. She's spoken extensively about her bipolar disorder.
And I think when people see people they admire being so vulnerable, it can really make a difference.
Yeah. It kind of gives everyone permission to do the same.
Exactly. It helps to normalize mental health challenges and encourages people to seek help.
Yeah, it's like, it makes it okay to not be okay.
Right. And that's so important.
Yeah. And, it's not just about the individual impact either.
Yeah.
This mental health crisis has huge economic and societal consequences as well.
Oh, absolutely. The economic burden alone is massive.
Right.
I mean, we're talking over $300 billion annually in the U.S.
Wow.
Due to things like healthcare costs and lost productivity.
That's a staggering number.
It is. And, it also impacts things like homelessness, the criminal justice system.
Right, that's all interconnected.
Yeah. It's a really complex issue with these, ripple effects throughout society.
So, it all sounds pretty bleak. Where do we even go from here?
Yeah, I know it can feel overwhelming.
It does.
But there is hope. There are a lot of organizations out there doing great work, like NAMI, the National Alliance on Mental Illness.
Yeah.
SAMHSA, the Substance Abuse and Mental Health Services Administration.
Right.
And, of course, the 988 Suicide and Crisis Lifeline.
Yeah, that's a great resource.
It is.
For anyone who is in crisis or needs someone to talk to. I was going to say, on a slightly different note, there's this book I read recently that I thought was really interesting. It's called Lost Connections by Johann Hari.
Oh, yeah, I've heard of that.
And one of his main arguments is that a lot of modern society is actually kind of set up in a way that's detrimental to our mental health.
Interesting.
Like, we're increasingly isolated.
Yeah.
We lack a sense of community, and we're often stuck in jobs that don't feel meaningful.
Yeah, that makes sense.
And he kind of suggests that, addressing those root causes is just as important as treating the symptoms of mental illness.
Absolutely. And I think, there's a growing movement towards that, towards really looking at the societal factors that contribute to mental health challenges and trying to create a more supportive environment.
Right. So it's not just about individual responsibility, but also about creating systems and policies that support mental well-being.
Exactly. And that includes things like, advocating for better access to mental health care.
Right.
Reducing the stigma surrounding mental illness.
Yeah.
Promoting mental health education.
Absolutely.
And supporting research into new and innovative treatments.
Wow. So we've covered a lot of ground here.
We have.
It's a lot to think about.
It is.
But I think it's important to remember that even though the statistics can be pretty grim, there is hope.
There is. There absolutely is.
And we didn't even have time to get into some of the other really fascinating aspects of this, like the role of social media.
Oh, right. That's a whole other topic.
And the debate over rising diagnoses.
Yeah, there's so much more to explore.
But if there's one thing that I hope you take away from this deep dive, is that if you're struggling, you're not alone.
That's so important.
There is help available.
Absolutely. And don't be afraid to reach out.
Yeah. And remember that 988 Suicide and Crisis Lifeline.
Yes, it's there for you 24/7.
It is. All right. Well, thanks for joining us for this deep dive into mental health in America.
Yeah, thanks for having me.
It's been a heavy topic, but an important one.
Very important.
And we'll continue to explore it in future episodes.
I'm sure we will.
Until then, take care.
You too.